Welcome to Anti-Aging Insights, where age is a state of mind and aging is a treatable condition. And now, here is your host, Dr. Teri Fisher.
Hey there, and welcome to this episode of the podcast. Today, this is a recording of an Instagram Live video that I did with my colleague, Dr. Gidon at Anti-Aging Medical and Laser. We talked all about acne today. It was a great overview of what acne is, what causes it, and the various different ways that we can treat acne at the clinic. And so if you are somebody that has acne, if you know somebody that is suffering from acne, this episode is for you. We cover it all in this episode. I hope you'll get lots out of it. And without any further ado, let's get right into the episode. Here's Dr. Gidon and I at Anti-Aging Medical and Laser talking all about acne.
Hello there, Dr. Gidon here at the Anti-Aging Medical Laser Clinic in almost sunny Kitsilano. Not quite. It was sunny last week, but hey. And with me today is my colleague here at Anti-Aging. I'm Dr. Teri Fisher, and we're going to chat about acne. Absolutely. Back to school, back to university, back to college. We're all going back. We've had acne, going on and off, but now it's flaring up and we're heading back to school. And what are we going to do about it?
So one of the first things that comes to mind actually is why are you talking about this? Why is it important? And for those of you that know somebody that has acne or suffer from some acne at some point in your life, you know that it can have a significant impact on how you feel about yourself and your confidence. The good news is that there are very effective ways to treat it. And that's what we want to share with you today. At a basic level, then why do we get acne? There's a couple of things that are going on. You get this proliferation, so you get more follicles that are increasing in number. That then can cause what's known as sebum, increased sebum production, which is the oil that is being excreted from your skin. When you get that, and the bacteria love that stuff, so you get more and more bacteria that are starting to grow in that area. And then as a result of that, your skin becomes inflamed. And you can see lots of different ways that acne can present itself with these cysts, with the redness, with pustules, with various things. And so a lot of the treatments that we do are hitting those different ways that acne is forming.
Right. So how do we stop this buildup of keratin and proliferating of the follicles? How do we deal with that?
So there's ways that we can do that. One way is through exfoliation. There are different topical things that we can use. Acids, salicylic acid, benzoyl peroxides. And some of you that may have used these types of things, you'll know that it does dry the skin a little bit. It actually helps to exfoliate the skin a little bit. And that's one of the ways that can help.
Yeah, we have products, PCA, ZO. We have some really nice products that some of them come individually and some of them come in a kit. Like a 2-3 month kit. You buy it, it's got your wash, it's got your toner, it's got your exfoliant, it's got your alpha hydroxy acid, so salicylic. It's got the whole shebang in it. Some of them even have benzoyl peroxide, and they'll help you to clean up and exfoliate nicely. So what's the next step? Okay, so now things have got blocked up and the oil is starting to build up.
This one is really interesting and it's very exciting. So then when we're talking about the oil that's being caused, until recently, just in the last couple of years, there wasn't as effective way as we have right now, other than medications like Accutane, where you have to do blood tests. There's a lot of potential side effects with that.
Mood effects, liver effects, cholesterol effects. There's a whole bunch of things that Accutane can do. It's good stuff, but it needs monitoring and it's a hassle. So finally, I'm pretty sure the
magic device.
The magic device, AviClear. This is a type of laser. It hits the sebaceous gland and shuts down the oil production, cuts it back. It's incredible. And this treatment over here was an AviClear treatment. 3 AviClear treatments a month apart, and shebang, a month later, you get a bit of a purge each time. And at 6 months, you're looking much, much better, and you can even top it up after that. So finally, we have a machine that cuts down on the sebum, on the oil production in your face.
It's really fascinating because lasers will target a specific type of cell. And this laser has been designed to specifically target the sebocytes, the cells that are creating that sebum. So that's why it is so effective for acne. And as more and more data comes available to us after another year of data, we're just seeing that the results continue to be there.
Previously, it was predicted that it would last for a year or two. Now they're talking 3 to 5 years. The effect of the AviCare oil reduction laser is going to be. Okay, so now the oil is there, you've cut it down, or it's still growing and producing, and that oil starts to get bacteria, as Dr. Fisher mentioned, and it gets infected. All right, so now what are we going to do about the infection?
So infection, we're going to use some antibiotics. That is certainly one of the options for acne. It can be applied as a topical. You can even take oral antibiotics. So those are some of the ways that we can also combat the overproduction of bacteria.
And funny enough, blue light kills bacteria.
Yes.
Yeah, you can get a dingy little LED thing on Amazon and sit in front of it with a blue light. We have a super powerful light device called a BBL, broadband light. And we have a setting and a program on that BBL for Forever Clear. You use BBL, you come in for quite a few treatments, and zap, 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 and it kills the bacteria in your skin. Does it without antibiotics, without creating resistance, because often antibiotics create resistance, and it's a great adjunct. So we've got the AviCare to stop the production of oil. We've got the BBL Forever Care to kill the bacteria and stop inflammation, because it's got a red light component as well. Now you've got an emergency. You've got like a major monster zip developing, and you're about to have a hot date in 4 days' time, or you're going to, there's no graduation, or you're going to school, or you're meeting somebody, you've got a business meeting. What do you do? Like, it's an emergency. Anything we can do for an emergency?
Certainly. So in those circumstances, what we can do, we're talking again about inflammation, and we can take a potent anti-inflammatory, which is essentially cortisone type of steroid, and we can inject it directly into that lesion. And these go away very quickly with that type of treatment.
It's miraculous. You can have a monster zip developing over there. That thing is going to rupture. Pop a little bit of corticosteroid into it. Within 12 hours, it's already shrunk down and the redness gone away. So that's like your emergency rescue acne treatment for 1 or 2 or 3 active inflammations. Okay, so now you've treated the acne. You've hit it with AviCare, you've hit it with BBL Forever Clear, you put on the Zeo and the PCA topical solutions, and you've got it good. Okay, you're in a good state, you're in this state here, you know, or you're in this state over here, and you've got 2 things happening. Either you've got holes, scars, or you've got pigment. You know, you get PIH, post-inflammatory hyperpigmentation. So when you get to that, what do?
So there are ways that we can deal with the texture of the skin now. And that involves a variety of different machines that we have here. A good example is, for example, using a CO2 laser, where we can create and encourage the body to reform, to regrow some of that collagen and essentially resurface the skin.
Yeah, it's like little pixelated, fractionated little spikes of laser thing that into the skin, cause damage, control damage, which then heals. The CO2 laser is great, but you've got to have skin that's up to medium Caucasian. If you're Asian, African, Latino, you're going to need something else for that. And usually then we pivot to either the pico-away laser, which will smooth and deal with some of the pigment without overstimulating and causing rebound pigment, which is crazy. Okay, so we can use the pico-away for that. And if you want to get a little bit more aggressive, you can go with the halo, which is a pixelated laser. It's got 2 lasers in it. Or if you don't want laser because you're worried that the laser, or if it's summertime and it's tan or you're darker skin, then we got the radio frequency microneedling. And the brand that we have is an excellent brand of RF microneedling, is Secret Quote. And that's, again, microneedles. The needles go into the skin. The microwave energy, the radio frequency energy goes down the needle, cooks a little bit, comes back out, and that causes controlled damage and then healing. So you want to smooth your skin. You go with radio frequency microneedling or CO2 laser or even halo laser. And if you want to deal with the pigment, you go with pico-away laser.
So to give you an idea, there's really a whole spectrum of treatments that we have that hits the acne at all the different stages, from the very beginning, like I said, in the proliferation, to the sebocytes, to the bacteria, to the inflammation, to the PIH, to the pigment, and to the texture.
And let's not discount what Dr. Fisher was mentioning at the beginning. Acne is not a mild little peripheral disease. When people scoff at acne, I call it acne shaming. But it's just acne. Don't worry about it. The adolescent or the 20-something person is concerned about it. And the parent or the partner or the friend, they discount it and say, but it has a social toll. It really, really does. To have inflamed skin and to have marks is socially limiting and can have emotional damage to the person that has it.
Particularly with the age that we're talking about, although acne can affect people in various ages, most often it's going to be younger people where their social interactions are so important to them at school, with their friends, the way they're seen, the way they see themselves. So it's something that we take very seriously.
Correct. That's why we do Avicare and VBL Forever Clear for the oil reduction and for the inflammation reduction. We do it on all ages. Adolescents, as long as you've got parental sign off on the consent, you can do it from age 13, 14 and above. There's no reason to wait until you're 18 when you've already got permanent scars, because those scars are permanent. It's much easier to prevent and to treat the acne in the early stage than to have the permanent scars, which are going to take months and months of treatment and thousands of dollars worth of treatment. So a little bit of money spent and energy and time spent on dealing with your acne now when it's active will prevent you having to spend thousands later on when you've got acne scarring. You're not going to become president of the United States and you're not going to become a CEO if you've got terrible acne scars, because people judge based on your appearance. It's unfair, it's nasty, it's shameful, but it's reality. Now, there's another type of acne that we didn't mention that people sometimes get. It's hormonal acne. And young women sometimes go on birth control pills for that. They go on spironolactone, which blocks the testosterone expression in the skin. And it was always difficult to control this, especially for men and women who don't want something internal. There's a new cream. There's Winlevi. It's a cream that actually blocks the testosterone expression in the skin. So you can Winlevi your cheeks and jowls where you get the hormonal acne and the cyclic acne that happens with periods, or the hormonal acne with the adolescent boys that gets this like this. This is the classic, your period's about to come and you start getting acne over here. And you don't want to mess with your hormones, but you can take Winlevi and that's a prescription, talk to us and you can come in for a consult and get prescribed and you can put Winlevi over here. I'm sometimes wondering, what happens if I put Winlevi on my scalp? Is it going to block the testosterone over here and I'm going to grow more hair? The other side, they're actually doing studies on Winlevi on hair growth. You want testosterone to be expressed in your whole body, but you don't want it expressed here to get acne and here to make this hair fall out. So we've got Avicare and VBL Forever Clear if you don't want to take oral Accutane or retinoids. We've got creams and we've got exfoliants and we've got retinols and cleansers on topically, and we've got the hormone blocking Winlevi topically on your face if you don't want to take oral stuff as well. So whatever suits you, whatever type of acne you've got, at whatever stage you've got, is it forming follicles? Is it too much oil? Is it bacteria? Is it causing scarring? Is it causing pigment? Whatever ails you with your acne, come in and see us here at Anti-Aging Medical Laser Clinic. Come and see Dr. Fisher, Dr. Govindasamy, myself, Dr. Gidon Frame, and we will certainly help you out. Signing off from Anti-Aging Medical and Laser Clinic in beautiful Kitsilano, Vancouver, British Columbia. Have a great one.
See you soon.
There you are. Hope you enjoyed that episode. Hope you learned a ton about acne. And feel free to come and meet with any of us at Anti-Aging Medical and Laser Clinic. We would be only too delighted to help you out. Until next time, hope you are doing well. Take care, and I'll talk to you again very soon.
Thanks for listening to today's episode of Anti-Aging Insights. Stay tuned to discover more of the latest news, treatments, technologies, and developments in non-surgical cosmetic and anti-aging medicine. For more inspiration, to access the show notes, or to book an appointment with Dr. Fisher, Dr. Frame, or any of the other anti-aging professionals, please visit our website at antiagingvancouver.com. Until next time, stay inspired and live life well.